Good morning, everyone. This is Freya Harris. I am the project manager for Michigan Benefit Access, and I work for the Michigan Association of United Ways. I hope that everyone has called in. You wouldn't be able to hear me otherwise. But please enter any questions into the into the chat box, because all of your lines are currently muted in order to reduce interference. If you do have any questions throughout the presentation, also feel free to enter those questions into the chat box, and I will respond to them as they are presented. This is an orientation on Michigan Benefit Access, and I will be covering the history and vision, then talking about the general functionality of the My Bridges system that allows for benefit applications online, then talking about what it means to be a community partner and the various roles that organizations throughout the state can take in becoming part of Michigan Benefit Access. So let's begin. I think we have the majority of people on the call now. First, I wanted to talk about the need and opportunity that brought about this initiative. As we all know, Michigan has been hit hard by the economic downturn, and an unprecedented number of people are going to nonprofit agencies as well as the state looking for resources. As a result, both the state and nonprofits were trying to figure out a way to be more efficient in providing these options to people who were in need, and also trying to understand why people who may be in a financial crisis would not claim benefits that they are potentially eligible for. There was some research done to figure out the reasons that someone would not apply for public benefits, and they are what you would traditionally assume: lack of knowledge of the system and who was potentially eligible, distrust of government, the stigma behind welfare, many stops in the process, the time missed from work to simply apply, those that are employed and discovering they're not eligible, at least at the time, and then those that have been denied before because of not knowing how to properly complete an application. So there was some thought into how can we help people to overcome these obstacles, these misconceptions, help people to realize that they may be potentially eligible and make the process easier so more people would be willing to attempt this as an option. The United Way believes in a stepped approach to financial independence, and that first circle of increased income is where we are with Michigan Benefit Access. It is about filling income gaps. It's about work supports. Public benefits are just one of many options that people can consider, and the goal is to help to fill in those income gaps as they are working and pursuing better employment or pursuing their education, but helping them to deal with their basic needs of today. Of course, we want people to move towards those next two circles of building savings and gaining assets, but first they have to be able to address their basic needs that they are faced with every day. The Department of Human Services offers 5 categories of public benefits. They are food assistance, energy and non-energy assistance, also known as state emergency relief, medical assistance, which is all 33 Medicaid programs, child care assistance, and then there's cash assistance, which includes the Family Independence Program as well as the state disability assistance. The Family Independence Program is the only program that actually has a term limit of 48 months, whereas the other programs do not. So even if someone is no longer eligible for the Family Independence Program, it doesn't mean that they could not still be eligible for state disability assistance if they have a disability, or any of the other 4 benefit programs. So making sure that you educate the public of all their options and understanding what the policies are for these options, because each program does have specific requirements, certain eligibility guidelines, and no one should just assume if they are not eligible for one, they could not be potentially eligible for another. There is someone having an issue with calling in, so I'm just going to respond to their question quickly to make sure we get everyone on the call. Just give me just a minute. Just one more second. think sometimes it's a little tricky in realizing there's a two-step piece to this. So let me make sure I get everyone on the call. I think we're set now. This initiative has resulted from a public-private partnership, and this partnership includes the Department of Human Services and a set of nonprofit agencies throughout the state. The goal was to do some research to figure out ways to make the process of applying for benefits more streamlined, understanding why people would not apply for benefits and trying to address those obstacles. And the result was the parallel plans to create an easy to access online benefit application system that is then coupled with nonprofit outreach. And as a result, many private foundations throughout the country and the state were very intrigued by the thought of a public-private partnership and a way to help people access benefits more easily. So there has been investment by a variety of foundations in this list, the ones that have been involved in funding the technology as well as the outreach that is going on statewide. As a result of their generosity, we were able to provide Michigan Benefit Access, which is to increase the economic stability for Michigan families by connecting them to multiple public benefits through the use of the My Bridges technology. There is a question of, can we use those resources directly? You may want to elaborate for me just so I'm clear of what resources you're referring to, and then I can answer that question. Here we have the circle that shows that this is a two-prong approach. There is the side that is technology, and then of course we need the outreach. It is not enough to have the fancy system if no one is aware, particularly the people most in need of it. And then there are those that may not have access to technology at all and wanting to make sure that this is accessible to anyone. So we need the outreach piece to inform the public as well as to provide another way for people to access this online application by using the community agencies that they probably frequent already for other needs and services. There is a question, can the resources of the partners that are providing funding and assistance, these are just national and Michigan-based foundations that anyone can apply to them for various initiatives that they have interest in. If you want more details about them, just email me after the presentation and I can share that with you. There's also a question about, can we get a copy of this PowerPoint? Yes, I will be sending that out to everyone after this call. The main goals of the technology are to provide anywhere, anytime access to apply for the Department of Human Service programs, as well as to check benefit status. This is a really important piece of being able to check status because other states have the way to apply, but then the person still has no way to follow up on their own on their case. So this provides that added feature. There's also the goal of reducing the number of local office visits and phone calls to DHS by recipients. Now the process will allow for many questions to be answered directly through the internet system by someone having their username and password to access their own case, and a large majority of their questions will be able to be answered through that system. There's also the way of being able to maintain benefits over time. Oftentimes someone may apply for the benefit once, forget that they have to do a recertification, or they fail to submit their documentation and then they fall off of benefits and either have to start all over again or they simply give up on trying to pursue them further. We want people who do continue to need the benefits to be able to maintain them, and this is made easier by the ability to upload documents directly into the My Bridges system. Here shows some statistics from back in August of just the numbers that have used this application system on their own without any direct assistance, as well as the other features they've used on the system. It is definitely was picked up very quickly by those that are just generally computer savvy and saw the benefits of doing things online. Now our outreach goals are to make sure that this benefit application system is actually helping those most in financial need. So we want to make sure that it's fair to everyone to be able to access it. And that means educating a broad set of social service networks throughout the state who can directly engage people in using My Bridges. This requires training, so we want to make sure that the community partners have proper training to navigate My Bridges and be able to effectively help people complete a quality application. Then we want to be able to provide a referral system so that those interested in help will have agencies that have received training and can be verified by the Department of Human Services as agencies that can truly help people in completing the applications. These referrals would also be made available through the United Way's 211 system. There was a question about how to become a community partner, and I will share that in the next set of screens. And a community-based organization is what CBO stands for, and that's what probably the majority of you are just community organizations doing a variety of services. Is a very general term. Now we want to talk about the target households. There are just some basic population groups that we want to make sure that this is reaching in terms of our outreach. There are those that have only applied for one benefit, typically food assistance, and may not have even realized they may be eligible for other benefits, or the process before was just so time-consuming they decided just to stop at food assistance. So helping them to come back and try this new method and to realize that this is an easier, more efficient way, and now they can consider their other options. There are also those that applied before but were denied, and we wanted them to reevaluate their situation. If they are still in financial crisis and things have gotten worse, they are probably more likely they may actually be approved. So at least allowing them to reconsider their option even if they have been denied before. There are definitely those with limited reading and computer literacy, and so we want to make sure that there are community partners within neighborhoods and close to people that they can actually go and receive that one-on-one assistance so that this isn't just a system for those that are computer savvy or are able to read. There are also those that never applied before, and those are people that probably never considered themselves to be in this situation, definitely don't consider themselves eligible for public benefits, and helping them to also look at their situation more fully and at least consider this as an option, especially since this can be done in the privacy of their own home. And then we also have those that simply lack transportation and computer access. So even if an organization, all that they really can provide in terms of being part of Michigan Benefit Access is computers, maybe they already have those available for the public to use for search for jobs or to use for other purposes, those computers can also be made available for someone to apply for My Bridges. Here we are sharing just some of the outreach that was underway in our pilot that is still going on now in Southeast Michigan. There are 16 pilot sites that range from traditional to very non-traditional organizations that may have never done direct service in this way, but are very involved in their communities, such as churches, and helping to build their capacity to be able to provide some level of service to people in using My Bridges. We also have 33 AmeriCorps members throughout the state that have also been tasked with engaging community organizations to inform them about the system, as well as helping clients directly with applying for benefits if an organization likes the idea, but they don't have the staff capacity to offer it. They can have an AmeriCorps member come on scheduled dates and be able to provide that level of service. I'll share some more about the AmeriCorps members later on in this presentation. We also have a wide sector of nonprofit associations that are involved in this from the very beginning, in the research stage all the way through the development of the system. And they currently continue to meet on a monthly basis to talk about how the system is rolling out, how to improve the technology as well as the outreach. And we anticipate continuing these discussions, especially as this initiative is continuing to develop as we speak. There is a question before I go on to the next set of slides of what is My Bridges. It says public libraries limit the amount of time our customers can use their computers. They lack the skill to effectively utilize the computer with the time limits imposed. We are actually going to be engaging libraries specifically for this reason of maybe offering a couple of computers that can be used for My Bridges, separate from their other public computers is one option, but helping them to understand the benefits of this to people that already come and use their computers for other purposes. Also, the application, the amount of time it takes to complete it does vary. Sometimes it can be pretty quick. Other times it may be beyond the time limit. So we are going to be engaging libraries to see how best this would fit in that type of setting. Every organization is going to have to think about how this would work with the things they already have going on. And we'll talk a little more about that in integrating My Bridges in a minute. So what is My Bridges? It is a 24-hour secure internet portal to the Department of Human Services benefit applications, and I provided the web address for those that may have never actually seen the site, but I will be showing you some screenshots as well. It is directly linked to the internal Bridges system, which is a great advantage because there's not that hiccup between trying to get the data that's compiled on an external system into the internal processing system. Everything is developed and maintained by the department, so the My Bridges technology is updated as policy changes occur, as application screens change. So again, there is that a seamless process in making sure that things stay up to date. The additional advantage is that this is a system that does more than just allow a person to apply. They also can check their status as well as recertify all online. Here are some additional features beyond just the applications and checking status. Someone can also allow access control to another household member, and this allows for another set of eyes to be on the case, which could be really beneficial for maybe one spouse has access to a computer during the day, the other does not. It just allows more than one person to be checking in to make sure they're staying on top of any request. There's also being able to see their correspondence electronically. All documentation and as well as decision notices are turned into PDFs and kept within the Check My Case piece of the system. And someone can actually go inside to view their case, be able to see all of their decision notices or any requests for documentation, and print it directly themselves. There is still paper applications that are sent out at this time, but I do know the department is working to go paperless, and so over time getting people more comfortable with viewing documentation online is one of their goals. And it is nice that you don't have to worry about whether or not your address is changing, especially if you are homeless or just temporarily living somewhere. You're able to see your decision notices anytime, anywhere that you can access the internet and print it yourself. There's also the ability to receive notification of new correspondence by email or by text. It's not required to have an email address or to have a cell phone, but if someone has those two added ways of being contacted, it is really recommended to include that information as well. That is not a required field in the application, but it is something that we share as a tip when we talk about navigating My Bridges. The more ways that the department can contact a person, the better. We also allows for increased benefit history. So someone can actually view 2 months prior of their benefit status. This feature does not allow the person to view if they have met their 48 months for the Family Independence Program, but it just gives them some brief history of only 2 months. And so this is just to give someone a little bit of their past. If they do have any more questions about prior months, they would still have to contact their DHS caseworker. I do have a couple of questions coming in, and I will address those in just a minute. Just want to get through a few more of the slides. This talks about the expansion releases that have occurred over the past few months. And as you can see, this system has undergone a lot of development and is continuing to do so. The last release that was scheduled for March is actually going to occur in April, and that is to renew benefits as well as providing this in Arabic. Right now it is available in English and Spanish. The screens toggle depending on which language you prefer. And so in April it will also be available in Arabic, and that includes the correspondence that is sent out as well. Since this is a system that is under development, we are learning how to improve it, figuring out what works best, and so it does change. You may go from 1 month to the next and see new screens or things that are just functioning differently. Hopefully it is an improvement to the way it functions. So this is not a system that has been totally fine-tuned and nothing's going to be changing about the way it functions, but we hope to learn a lot from how people are using it every day and sharing that with the department so that they can continue to improve it and make it even more efficient. Some basic needs to know about My Bridges, and this is just for someone who is computer savvy and probably could just go in and start on their own. There's just some basic things they should know. First of all, there is a basic practice that's available on the home screen of My Bridges, which I'll show you. And this is a very short navigation, but it just gives the person the basics, and one of those are that they should only be using the next and back arrows. As they use the browser buttons, it will push you out of the system. Also, this application can be saved for completion later. This is really important, especially when helping someone. If they find out they don't have enough time, that they can go ahead and save it, finish it on their own, or come back to you to have it completed. This application is saved for up to 12 months without submission. So until they press submit, nothing happens with the application, but it does stay in the system for 12 months. So someone could start it 1 month and come back 2 months later and still be able to finish the application. As I mentioned before, there is the ability to check status, and so this includes for those that have used paper applications in the past or may be current recipients of benefits. They can now create their own username and password and access their existing case. So this is really being targeted not just to new benefit recipients or new applicants, but we want to make sure that existing recipients also use this more readily to get a lot of their commonly asked questions dealt with, especially when it comes time for recertification. In addition, because this is a username and password setup, of course people forget their usernames and passwords, so there are up to 5 times that someone can enter it incorrectly before the system locks them out. However, the system also allows for them to create up to 3 new username and passwords to be able to access their case. That is a very brief instruction on navigation, and if you were to attend the in-person My Bridges navigation, you will get the detailed version, walking through all the screens and getting the helpful tips of how to make the application more efficient in getting through the screens and saving time. But that would cover the basis for someone that was pretty computer savvy. Here's the home screen that shows how someone can access that basic practice. And here is where someone would be able to save and exit so they can come back later. When they did return, this screen would show, which would allow them to keep working on their application or allow them to go ahead and set their filing date. Since it's, the majority of the benefit applications allow for you to apply at any time. The only application that requires for the full completion is the state emergency relief, which allows for energy and non-energy assistance. The other applications, someone can simply enter their name, address, and press submit to set their filing date. However, we don't recommend that necessarily because we do want people to get as much information into the system as they can in order to get the processing going more efficiently. The more the caseworker has up front, the less they have to follow up with, and therefore they can just focus on the documentation pieces and getting the decision as soon as possible. Here's where someone will be able to view their case. It's the main screen, and it would only show the benefits that that person actually applied for. This is just showing all of them. Here someone can actually grant access to another household member. This shows the decision notices that are sent out in the mail are also turned into PDFs. So the person is actually able to view everything they will receive in the mail and probably see it first in the system before they receive it in the mail. They can then print it, and if it is a denial letter, they actually can take it on to another agency that would need proof that they've already applied for public benefits and then be able to move in seeking other resources. So it does save the person the worry of having to wait on the mail or potentially losing their decision notice, because even if they did, they could go into a community organization that they were seeking assistance, actually go in using their username and password to access their own case and have their decision notice printed right at the agency. Here is where someone would enter their email address in order to receive notifications by email, and if you provide your cell phone number and permission to receive text, you can also receive text messages. On this screen, it shows how someone can submit their documentation through the system electronically. It provides a list of all the different types of documentation that could potentially be requested. We're not saying that someone should submit everything on here. There are some basic documentation that could be submitted in advance, such as ID and birth certificates and proof of income, just the things that are generally asked across the board. But no one is required to submit documentation in order to submit an application. This is an added convenience and does help with the efficiency because the caseworker would have these things, but they would still have to contact the individual directly. It will be a phone call for food assistance, child care, as well as SER, not SER, as well as Medicaid. The SER and the cash assistance would still require an in-person interview. And for any of the programs, actually, an in-person interview may be requested. But more is trying to be accomplished through phone interviews and through self-service processing centers, which are another piece of this new way of accepting applications. And I will share a little bit about that in a minute. But I just want to make sure that people are clear that documentation is not required to submit the application online. The DHS caseworker will still verify all documentation submitted and will follow up on requesting anything else that is needed. Here shows that you will need a scanner in order to upload any documents that someone does want to submit in advance. We do understand that not all agencies or persons have scanners, so that someone can still send in documentation by fax, walk it in, or send it in by mail. There is also the, right here, the screen that shows how you would select the particular document that you want to upload, then press Browse to find it on your computer, and then it will be uploaded. You'll also be able to view all the documents that you have uploaded to see that they are in the system. Don't worry, however, because if something happens and you can't upload, because we do have that problem right now, there's some areas that are having some problems getting things to upload, the DHS caseworker will follow up. And I also want to share with you our recommendation for retention of these documents on your computers. Because this is confidential information, we want to recommend, highly suggest, that once your appointment is done with that individual, that you delete all documentation for them off of your computer. There's no reason to keep it because, as I said, if anything happened and the documentation didn't get attached, the DHS caseworker would still follow up to collect what they needed. This is just an added advantage and not something to fret or worry over. But the biggest thing you need to worry about is the protection of confidentiality of that person. So you do want to remove that documentation after each appointment. Don't even wait to the end of the day. And one more screen before I tackle some of these questions you've presented me with. This screen shows that someone can check their past benefit history for up to 2 months in the past. So let me look at some of these questions. Looks like you have some great ones here. The first question is, will there be a test capability in MI Bridges for training and practice purposes? Not at this time, and it is actually the department that would decide whether or not we have a test environment. We have made that request, and we're just working on the procedure to have that available to the public. Right now, we do the in-person trainings, and we also are working with the department to provide training as an e-learning curriculum because they will expect organizations that want to be registered community partners to receive training. So we need to have more capacity to do that, and e-learning would allow for that. That e-learning curriculum, however, would be a video, which would just have voiceover walking through screenshots. It would not be interactive at this point. And so over time, we do hope to have a way for persons to practice directly in a test site so that you can get kind of that hands-on training before you help with someone directly. We have quite a few people already, not people, but organizations that are engaged in helping people with MI Bridges. Either they are just fairly used to doing paper applications, or they've received my in-person training. And it is a pretty intuitive system, and it's a smart system. And so for those that are used to completing applications for other things online, you pick up the pieces pretty quickly once you get the tips. And so it's not as daunting as it seems, and a lot of organizations throughout the state have already begun helping people. The next question is, so it will allow a social worker to view the case also? No. This system is really intended for the applicant and for their privacy. And so the username and password they create is something they literally create themselves. You may have to actually type it in for them if they're not comfortable with computers. But it is a username and password that they should walk away with and for their purposes. If they would like assistance from someone in understanding the correspondence they receive and coming back when it's time to recertify, they would be coming back with their username and passwords for you to access their application together so that you can walk them through this, because this is all their information that they are agreeing that is correct and accurate, and we want to make sure that it is kept confidential. We do realize there are organizations that have legal relationships in where they serve as a payee or a guardian to individuals, and those are unique legal situations that would allow for more direct interaction. But that, again, is something that would need to be addressed with the department. I know some agencies have direct relations with the department in terms of collecting information on behalf of their patients or their clients. So if you already have those existing relationships, those would continue. It's just that this system, as for when we train, it's about volunteers and staff persons that do not have that level of relationship, and they are trained to let the applicant be responsible for maintaining their username and password and in terms of accessing their case. So I hope that answers your question. But if you have any follow-ups, please let me know. The next question is, how does the applicant submit their supporting documentation? I think I shared that. It is through a scanner and then searching for it through the browse and then uploading it. It's pretty straightforward as you would upload anything else, but you can still submit things by fax as well as walk it in or send it in by mail. It says here, participants have had issues when they have forgotten their username and passwords. That is correct, and the department is aware of that too. And so that's why it allows for so many times to enter it incorrectly. There's also the creation of a secret questions. There's 2 secret questions that each person has to create. So before they reach that 5 limit, they really should first try to remember their secret questions, and they can have their password retrieved. That is one option. And then if they really are logged out, they will have up to 3 additional times to create new username and passwords. The department is getting questions about what happens when they're finally locked out for good and resetting things. And so they are working on a process to respond to people's requests for being totally reset if they lock themselves out permanently. The next question is, would this be available by fax or mail? Yes, you can send in documentation by fax or mail. And also the next question is, are we able to fax in an SCR form? Yes, all documentation can still be faxed in. The SCR still requires in-person interviews with the department caseworker. So anything that isn't submitted correctly or there's still needed information, the DHS caseworker would still follow up with each individual person. But we try to do as much as we can online, including for the SCR. The SCR application for My Bridges won't even be accepted without being filled in its entirety. So it helps to make sure that all of the questions are covered. If a person applied online but needed to submit supporting docs in another fashion, where they go, would they have a caseworker yet assigned? Well, let me go ahead and share with you now. That kind of leads to another question or another set of information. The department has provided a new process that is somewhat different than what most are probably used to. Instead of these applications going directly to a local caseworker in all situations, the cases go to self-service processing centers. There are 3. They're located in Grand Rapids, Lansing, and Detroit, and they cover the entire state. The Grand Rapids location covers the majority of the state, actually, and this is where these electronic applications are first sent. If it is a simple application, meaning a first-time applicant, there's not any complicated questions or issues, and there's not an existing case and it's not an SCR case, then it actually can be approved and denied at the self-service processing center. These centers are all staffed by DHS caseworkers also. They just have a slightly different role because they are focused on online applications. And they are the ones that actually contact the persons by phone to verify documentation and to finalize the process for them. So oftentimes applications are responded to a lot quicker because of this new way that the DHS is handling processing for online applications. If the application is more complex, and I don't have a definite set of definition what complex would mean, it really does vary based on the situation. But if it is a complicated situation or there's an existing case with a local caseworker or it's an SCR application, it would end up going to a local caseworker. In that case, the individual caseworker would be put into the My Bridges system, so the person can actually go into View My Case, check their case status, and it would say the name of their caseworker, their phone number, and email address. And so all applicants eventually have a direct caseworker, whether it's through the DHS self-processing centers or a local office, and their names are provided. So they do have someone to contact if they do need a real person. It's just that this new process will make things a lot more efficient, and from what we've seen in our pilot, people are getting responses much sooner. Let's see, the next question is, I actually have quite a few questions here. What I'll do, we do have quite a few questions. And so let me go through the Becoming My Bridges Community Partner, and that's a pretty short piece. And then I'm going to go back to your questions because I would like for all of you to hear the responses because these are good questions. So becoming a community partner. And I want to first explain what a registered community partner is versus just an ordinary community partner, which majority of you are. A registered community partner is someone that is registered in the My Bridges system to be recognized as a partner that has received training and has their background checks and belongs to a nonprofit organization. To be a registered partner at this time, the agency needs to be a nonprofit agency that has committed to helping Michigan residents apply online for benefits through providing access to a computer or just one-on-one assistance. This particular process is still under development at the department. Although it says at this time that nonprofit agencies are the only ones allowed to register, that may change, and so I just want to share that with you. We'll have the definitive set of criteria and requirements in May. But I will give you kind of the overview of what's generally going to be expected of any organization, regardless of type. But any organization can be involved in Michigan benefit access, for-profit, government, nonprofit, in some level or capacity, but they may not be able to register in My Bridges and be recognized by the department for referral purposes to people who are seeking a community partner. And so I just want to make sure that people are clear on the distinction that we already have plenty of community partners of various types throughout the state already using My Bridges with their clients, and will continue to do so. But there are some added advantages to registering, and so we just want people or the organizations to know their advantages and make the decision if they want to register. So the main advantage is having the direct link to the state for information and support. Since this is something new, people have a lot of questions. And these questions actually help the state to kind of think through some things they may not have considered before. So it's also a way to share what's going on the ground so that the system improves and the outreach improves. You'll also have a known impact in that you will receive an agency number and passcode that will be used to track the applications that go through your organization. And this allows the department to know who is turning in quality applications regardless of the decision of approval or denial. They just want to make sure that the organizations have the training and the support that they need in order to effectively help people. As I said before, you'll be able to share with the department what you're learning on the ground in order to improve the application system, but also be able to share best practices between organizations that are also registered partners. Registered partners would be kept on a list with the department, as well as we would want to include them in our 211 referral service. But again, knowing that all organizations have different obligations beyond My Bridges, and 211 definitely takes that into account in making sure that we shared the hours you're open, the populations you serve, various things in order to help so that you're not just inundated with people looking for assistance with My Bridges. We want this to be an added benefit that you give to your current clients, an additional way to engage new populations that maybe you haven't supported before, and to make it a part of what you already do, not an added burden or to create an unnecessary situation for you. We also want to help to promote the mission that you already have of helping people achieve self-sufficiency, and then also be able to help save time in terms of tracking down decision notices so that those that are denied, you can more quickly assist with other resources that you have. But we also want to help people to get off of those emergency resources as soon as possible, so helping those that are truly eligible for benefits to access them so they do not need emergency resources on an ongoing basis. There is a question I will answer that's regarding the community partners. Can we get a list of current community partners? That list is maintained by the department, and currently those organizations have not all been through training. That original process to become a community partner was really simple. That's why it's being changed. It was a really simple form. Anyone could fill it out, including individuals. It didn't require any training. It just was saying, I want to be recognized as a community partner to have my applications tracked that come through my agency. And so the department was aware of who was potentially doing applications, but with this new system, we really wanted to make sure that people were using it effectively. And so the department will be contacting all of those existing community partners, informing them of the new criteria and requirements that will be hopefully finalized in May so that they can get the training either in person or online. And then they also would have to have background checks, at least the iChat. And so I'll share a little bit about that. So some of those existing community partners on that list will not probably be on that list. So we're not making that list public simply because we don't know who of that list has received training, and we want to make sure that the list that we do provide is those that are recognized by the department as registered community partners. So this is the process that is anticipated to be available in May, and it just gives some of the basic information that would be expected. Of course, the name of the organization, at least one contact person to serve as the contact for the department, and then the names of all persons that will be engaged with helping people apply for benefits. Their background checks would need to be received, and that is only being required at the iChat level, which is available for free to nonprofits. Also, at this time, there would be a need for proof of nonprofit status, but that may change as well. We do realize there's lots of organizations that may not have yet received nonprofit status, but are very strong relationship with their community and doing great work. And so the state is taking the time to think through how best to ensure that the right community partners are involved in this and making the criteria in order to include them. So just want to let you know that we will give you the specifics when we have them as well. So once that information is collected, it's reviewed by the department, and if everything passes, then the agency receives an ID number that is used by all the staff. And this will allow for the department to know what applications are coming through that organization. The department will also be able to track IP addresses of where any application originates. So if a community organization isn't registered but is doing a lot of applications, the department will be able to follow up and find out why they didn't register. And it could be that they don't have a nonprofit status. And then figuring out a way to make sure that the community partners that are doing a good work are a part of the registration process. As I mentioned before, all sorts of organizations can assist people or help them at varying levels to be involved in My Bridges. And so even if not every organization wants to directly assist people one-on-one, there are other ways that they can be involved, and I'll share that as well. But first, I wanted to just touch on what a community partner is not. And this is really for what you would share with someone who is sitting down with you to help them with an application, because it's going to maybe appear that you have access to a system that they do not. So first of all, letting them know this is available for them anytime, anywhere, where they have internet access, and if they feel comfortable, they can actually complete this application on their own. Most importantly, that you are not staff of the Department of Human Services, that you are staff and volunteers of your own agencies, and that you have no control over approval or denial. Your role is simply to help them enter in the basic information so that that information can be forwarded to the department for processing. Also, you're not their authorized agent unless you do have that relationship because of the work that you do. But you also are not going to be able to ask information on behalf of the applicant unless, again, you have that legal relationship with someone. Within the application, it does allow for those that are guardians or legal representatives of someone to apply on someone else's behalf, but you will be entering that that is the capacity that you are serving and signing that you are that type of person. So when we train that the only selection that should be chosen is that you are a staff or volunteer of a organization, so that it is understood that this is being completed on behalf of someone else, but you do not represent them in the capacity to request information for them. When someone does need help, if it is a question about their application or the policy or whether they are approved or denied, all of those questions need to go to the department. If someone simply has a confusion about what a particular piece of documentation is that they received in their correspondence, that's something you probably could answer. It could just be the legalese or the way it's phrased isn't making sense. So there are ways you can help people, but you do not want to provide policy guidance or go beyond simply helping someone understand how something is being asked in a letter. If you can't answer questions, you really should be forwarding them back to the department. If they would really like help, having them there for them to be on the phone with the caseworker, and then you can be there as well to help clarify and interpret things for them. The biggest thing is empowering the applicant to do as much of this as they can on their own, and that will be new for many. But I think being able to just view things online would give people a level of comfort as well. So helping them to get back in to view their case may actually provide a lot of relief, and they may not have even realized when they walked away from you that they could do that. So you do want to share with them that this isn't just for applying, it's also to view where their application is in the process and getting them back into My Bridges with using their username and password. So the next part is integrating My Bridges into your organization. And as I mentioned, it is about thinking how this works within your community. Every community is different. Even if you have a sect of social service networks that already work really well together, figuring out how you can interweave this into the services you provide. Then there's also thinking about how it fits into the work you do in your organization and every day. So wanting to make this something that is available for all different types of organizations to be involved in some way or another, but really thinking in advance about what you really are capable of doing and maybe gradually adding on more pieces once you become more comfortable. These are some levels of engagement that we recommend. The first and the easiest is simply promoting the materials about My Bridges, because we just want the public to know. Because this isn't just for people to come to someone else to help them. There are plenty of people who can do this on their own, but they just not be aware of it. This is great for public libraries, especially if they definitely don't have the staff to help people, but just want to inform someone that they have access to My Bridges. Then there's providing convenient locations by providing access to a computer. Computers you may already have in use for other purposes. Maybe deciding to designate an extra computer just for people to come in and apply for My Bridges is something you can choose to do. There is not funding specifically to help all organizations build their capacity in terms of providing computers, but there will be some mini grants over the next several months to smaller organizations that do need that capacity lift, who really want to be involved. I will be sharing updates as that unrolls to anyone that's participated on a webinar. We'll be including your email in our email distribution list, so you will be getting emails from us. If you don't want them, just let us know. But this will allow you to stay updated on what's going on with this initiative, because it is definitely rolling out in pieces. Everything hasn't all been figured out, and we want to make sure that you are kept up to speed on that. There's also the ability of just manning computers, which means you have one or two staff persons who have the basic navigation knowledge, but it will not actually be directly assisting people. This is for people who generally can do it on their own, but may get stuck and just have a basic question. So you want to make sure that you explain that that's the level of interaction you're going to give them, but it is one way of being involved without having to do one-on-one assistance. For those organizations that do want the one-on-one opportunity, then the My Bridges navigation is required and will allow for you to more efficiently help someone move through the application. So again, just thinking about your capacity, the types of services you already provide will help you to think where can we start in being involved in Michigan Benefit Access. I know it may seem that it'd be great just to be able to provide some one-on-one, but that may not be where you're at right now. But if you can at least get things rolling and making people aware that it's a great first start. There's also looking at the availability of volunteers or our AmeriCorps members to provide access for people to get that one-on-one if your agency can't do it yourself. There's also taking advantage of your existing events that you may already organize and using that as opportunities to promote as well as maybe set up application appointments. And so these are our outreach resources that we offer at this time. Number one being the Department of Human Services Community Resource Coordinators, and they offer a variety of services to community partners. And so they were tasked, even before AmeriCorps members came on, with connecting with community partners, which is probably why you're on this call today. And so we want to make sure that you stay in contact with them if you do have questions about particularly more policy-related issues, and also if you want to find out about opportunities for training or to connect with an AmeriCorps member. We have instructed all of our AmeriCorps members to contact their CRC within the first week of service so that their CRCs are aware that they are in the community and available to community partners to provide assistance directly to clients or to help coordinate training events. There are also food bank outreach workers who are full-time staff and focus on food assistance benefits that also are available to come to agencies and provide direct one-on-one assistance. The training opportunities include this orientation, which we will be continuing to provide on pre-scheduled basis. And then there's also that in-person navigation training, which covers more about consumer protection, how to create a username and password, and then how to navigate through a multiple application. The key there is multiple, and I usually stress that even sooner than this, but this application does allow for someone to apply for more than one application at one time. And it's really to their advantage to do so rather than coming back and doing one application individually. The goal is to get all that basic information up front, and then the system is smart enough that it then goes into the different applications that they have requested to apply for. You won't really know why certain questions are being asked. The system kind of rolls with how responses are made. Depending on each individual situation, the system will take that response and then that will trigger another question. So it is really to the person's advantage to do multiple applications. Otherwise, they would have to enter their basic information again each time that they come to do a different application. And that helps to save also in times of appointments if you are helping someone directly. But we cover all of that in the navigation training. It is provided in person at this time. It takes about 3 hours, sometimes maybe 2.5, depending on the level of questions. That is why it is a little bit longer, because it is very much an interactive engagement where you have opportunities to ask questions throughout the presentation. The department is also working with us to develop the same type of training, but in the e-learning curriculum, which will be like a video, where you'll actually be seeing how the application moves through the various questions, but it will just be voiceover. There won't be an opportunity to ask questions while you're doing it, but you can always follow up with the department or with the Association of United Ways to get follow-up questions answered. This is going to be extremely helpful once this community registration process is made available to the public, because we're going to have more requests for training than we can accommodate. So we are definitely going to be encouraging people to use the e-learning curriculum, but we want people to have an option because everyone has a different learning style. And it may just work out to have a set of staff just come to one in-person training instead of them each doing it individually. And there is a question about the training I want to go in and answer. There is no cost. This is free of charge. All of this is free of charge. My Bridges, no one should ever charge anyone to complete My Bridges application. And also the training is free as well through the Michigan Association of United Ways or through the department. So the training opportunities will be pre-scheduled as well as by request. We will be having some pre-scheduled events in April and May that I will send out the links for those to this group. You'll be the first to actually get it. I just scheduled them yesterday. And so there's 2 in Detroit and 2 in Lansing. And this will be, there is a limit on how many people can attend a training simply for availability, but also there is a minimum that need to register in order to have the event. We have never had a problem with meeting our minimum, but we do sometimes exceed the maximum. So if you are not able to register, you can send me an email to be added to a waiting list for our next pre-scheduled training. We also will do trainings by request, but we do want to recommend that multiple agencies participate. Even if one agency is contacting me, I will set it up and then make sure that their staff gets registered, and then we open it up to other community partners. So we make best use of the time as well as have some cross information amongst multiple organizations doing it together. At this time, our website, Michigan Benefit Access, is not yet live, but that is where we will be pretty much showing all of the trainings that are coming in the future as well as webinars. That website is due to be available mid-April. In the meantime, I'm just sending out the links to anyone that has attended our webinars to let them know and that they can register directly. All registration for webinars as well as in-person training is done online. This allows a much easier way to contact you as well as for you to contact me. And then you are free to share that registration link with others as well. So this just shows things that are coming. Of course, we'll have the e-learning curriculum and the website, but also advanced modules will be available in the future as we learn more about how to best provide this to people. We also want to offer train the trainers so that we can get a good set of trainers in communities. This is something else that is still under development and we'll be keeping you apprised of over the next several months. So that concludes the presentation, and we already have met our 11 o'clock time, but I want to just cover a couple of questions, and then I will follow up with the rest of the questions. What I'm going to do actually is for all the questions that have been entered, they are saved for me, and I'm going to provide a response to all of them and send it out to everyone. I think that may save us some time and keep us from having to stay on the call any longer than necessary. But I definitely will be getting this out to everyone so that they can see all the answers because we have a lot of questions that are really good and I want to make sure that they are covered. There is one question I will answer is about the AmeriCorps members that the question is, have they received the 3-hour training? Yes, they have. As part of their I guess orientation, they get it's a 3-day orientation they get, covers a lot. But part of that is the 3-hour training as well. So they are actually seeing all the screens and are able to ask those questions, and they are told to hit the ground running to immediately begin connecting with community partners as well as setting up appointments, because it's really using it that teaches you, since we don't have that test site right now, and we give them a manual that they can use for kind of like their cheat sheet to hit refreshers and make sure that they're doing it correctly. But yes, they do receive that training. So I will be following up with everyone with answers to all the questions, and I do greatly appreciate your time. I think this is probably the best set of responses for questions I've had so far, so I'm excited to get these answered, and you'll have it to you by the end of today along with a copy of this PowerPoint presentation. So thank you all, and have a wonderful rest of your week and a wonderful weekend.
Thank you. Please stand by.